Hello, my name is Lennon Van Camp, and today I'm going to be discussing the increase in healthcare and the impact. So today we were going to be discussing complex problems. Throughout this course, we have talked about complex problems and specifically how to approach them and how to know what can be considered one. Complex problems can be defined as those that include the ability to approach them from multiple, sometimes competing perspectives and which may have multiple possible solutions. Complex problems can range from being local, global, or national because it can be created from anything that can have many solutions due to the different perspectives. Complex problems can be challenging at times because it forces you to look outside the box and consider every approach and factor that can lead to a solution. So I chose to speak about this issue because in the future I want to become a therapist, and with that patients have to pay bills and copays. For that can be difficult to pay, especially if you are behind and they add up, creating a bigger bill. I want to help fix this issue because I don't want money to be the reason someone can't get help when they are struggling mentally. So there are many that are already aware of this rising issue since it affects so many, but today this video is intended to be viewed by soon-to-be graduating college students, along with older adults ages 65 and above. Graduating college students should hear and learn about this issue because they will soon have problems with healthcare and graduating and being on their own. Figuring out how the system works is hard since there are so many rules, and it is hard for college students to understand due to the lack of knowledge. That's not intentionally, but with little experience, unless they grew up in a household that struggled with medical bills, and all that was talked about in the household was money and paying off those bills. Along with graduating college students, adults ages 65 and above may have a difficult time understanding how the healthcare system works, since it is constantly changing in rules and regulations, making it harder to keep track of what is going on. Not knowing about this issue can cause problems because a person may be cheated of their money from not knowing any better and what rights they have regarding healthcare. Now we are going to break down who was the most affected and why. In the article, Americans' Challenges with Healthcare Costs, it states that about 6 in 10 Black and Hispanic adults, 58% each, report delaying or skipping at least one type of medical care in the past year due to costs, compared to 49% of white adults. Similarly, about 6 in 10, 63% adults with household incomes under $40,000 and 55% of those with incomes between $40,000 and $999,000 report delaying some sort of care due to cost, compared to 3 in 10, 31% of those in households making $90,000 or more annually. This goes to show that Black and Hispanic households struggle more to pay for medical care because they receive lower income, forcing them to skip certain medical care, all from not being able to afford it. The increase in healthcare can have other effects on people besides just being in debt, but also mental and physical health issues. In the article, How Medical Debt Affects Health, a review of the evidence, it states that people who have medical debt or trouble paying their medical bills are more likely to have health issues, including high blood pressure, worse self-reported health status, poor mental health, and shorter life expectancy. Due to the stress of trying to figure out how you're going to pay for these bills, it can cause even more health-related issues, creating more bills to pay, causing a vicious cycle. Since medical bills are so high and overpowering families, they have to make changes and cut things out of their life just to pay for those bills. They skip out on vacations, having to borrow money, take from savings, work more hours. As you can see, the list goes on in this picture above, and there are plenty more ways that people try to do anything just so they can pay these bills. By doing this, they are missing out on a fulfilled life, living the best they can. Instead, they are stuck in debt. So the reason the complex problem of the increase in healthcare is considered one is because that it can have many solutions and not just one simple solution, since the healthcare system is so big and it spreads across multiple different services and care. There are always easier and more simpler solutions, such as using your benefits, planning ahead, taking care of your health, etc., but an actual solution that can realistically do something is to encourage providers to deliver better care, eliminate unnecessary services and waste, and operate more efficiently. In many occasions, people not only have to pay high bills, but they have to pay bills for things they never used or needed, but they still pay for. Medical and healthcare tends to overcharge people for unnecessary things, taking more money that they don't have, and by cutting this, it will help reduce the cost of healthcare. Although this is not the only answer to solving healthcare problems, since they range so much, it is one step towards making a difference. Thank you for your time, and I hope that you learn more about the healthcare system and how people are affected by it. and to look at it from a different perspective to help yourself and others. Thank you.